health doesn't happen in the doctor's office, right? Health happens in your kitchen, right? Health happens in your school, in your workplace, in your faith-based organization. Health happens where we live, where we work, where we play, and where we pray.
All right, Mark, it's great to see you. It's
Good to see you.
A pleasure.
Good to see you, Joshua.
Thank you. We were just talking about Silicon Valley in the 90s and how even though year to year it continues to grow with healthcare, where's the future from your eyes?
Well, the future is in the shift in our understanding about what really causes disease. You know, our whole healthcare system is based on the idea that disease just happens to you and that we're going to find the cure for diabetes or heart disease or Alzheimer's with a drug. But that's a completely false idea, because what is ailing us now is driven by the food we're eating. We ate ourselves into it, we're going to have to eat ourselves out of it. And so the future of healthcare is really going to be disrupting the idea of how we treat patients using functional medicine and food as medicine and food as information, and disrupting the food industry, forcing them to change how they produce and how we consume food.
Tell me more about the food industry.
Well, you know, the food industry makes $1 trillion a year from feeding us food that makes us fat and sick. That's an unsustainable burden that's having a huge impact across society, not just in terms of healthcare costs, not just in terms of our global competitiveness because kids can't learn in school anymore, not just because of our national security because we can't mount an army because our kids are too fat to fight, not just because it's affecting our climate because of how we grow food and how it affects our aquifers and our soil and CO2 production, methane that affects environmental degradation. All those things are true. But what really we have to understand is that the food industry has to shift the way they act, and they have to shift it by changing the foods they produce and consume and change the way we grow food.
And what about doctors? What do they need to change?
Well, right now I'm in a very exciting conversation with the Cleveland Clinic, which is the leading innovative healthcare organization in the world. And they've come to me to ask me to start a functional medicine institute in Cleveland to bring to the world a different model, because they understand that their model is broken. They understand that the future of healthcare is about creating better outcomes, creating better value, which is getting people better at lower costs. And the only way to do that is by dealing with the root cause of disease, and medicine will shift. And as we prove the model, reimbursement will change, practice will change, doctors will change education, we'll change research, and we're really at this cusp of shift right now, and I'm very excited about it.
What do you see as the role of health coaches?
Health coaches are essential. I mean, I don't see how we can have a future of healthcare without health coaches. You know, I went to Haiti after the earthquake, and I realized that Paul Farmer did not cure TB and AIDS by better drugs or surgery. He cured TB and AIDS in the poorest countries on the planet, which everybody else had given up on, by the power of community, by the power of community health workers, coaches basically, who would help their peers get healthy. And I think in the future of healthcare in America, we have to train 1 million community health workers, 1 million health coaches that are right in the middle of healthcare, working with doctors and healthcare practitioners, working in communities to change the healthcare of America. We did this in, for example, Saddleback Church, where we got 15,000 of Rick Warren's people to lose 250,000 pounds through the power of peer support. And all we used was the simple idea of a host. You have to be a host, someone who's willing to facilitate a group, to coach people, to be an anchor. And they didn't even actually have to know that much. So the content of what you need to know is important, but we have the knowledge of what's the thing we need to do. But we need people working together with other people that's going to solve this problem.
So what would you suggest to health coaches who are looking to get in with a doctor's office? How would they approach a doctor effectively?
Well, I think you know, there's a really interesting opportunity to work with healthcare. But it's difficult because doctors aren't used to working with health coaches, and there's no reimbursement model for working with them. So what I think we have to do is create a disruptive model, which is community-based solutions that are in churches, in schools, that are in faith-based organizations, that are in workplaces where health coaches can be and deliver a service where it's needed. Because healthcare has to be turned upside down. We have to put people and communities at the center of healthcare. And the best facilitators for that are going to be health coaches. And there is a role for them in healthcare, and we're going to do that at the Cleveland Clinic. I do that in my practice, but I think it's a big step for for most physicians to include health coaches because there's no reimbursement model. So their patients have to pay out of pocket, and they're not used to it. And they also don't know actually what a health coach is. They don't know what their services are. They don't know what knowledge they have. So there's a barrier there. But I think if we create a disruptive model where health coaches are working in the community and not worrying about healthcare, and actually create a parallel system of community-based solutions for healthcare like we did the Daniel Plan, that wasn't in the healthcare. I mean, health doesn't happen in the doctor's office, right? Health happens in your kitchen, right? Health happens in your school, in your workplace, in your faith-based organization. Health happens where we live, where we work, where we play, and where we pray. That's where health happens.
So what about, how would they approach a corporation?
Well, I think corporations are really struggling, and they're actually paying healthcare costs for their employees that are really bankrupting. When Starbucks pays more for healthcare than coffee beans, when Chrysler pays more for healthcare than for steel for their cars, we have a very disturbed system. So they're looking for solutions. I'm working with a Bank of America now because they are interested in creating wellness-based programs, but nobody really knows how. And I believe that health coaches are instrumental to the success of those programs. And that's really the way we change. We change biology through using the right science, the science of functional medicine, the science of using food as information, eating our medicine. But we change behavior by the power of connection, by the social relationships we have, by the power of health coaches to actually engage with somebody and connect with them in the places they're stuck or in the places that they need support or encouragement. And that can be used in a workplace situation by working with the kinds of existing structures and wellness programs they have, or actually meeting with leaders in HR and actually working with them to develop programs. So there's a huge opportunity, and for innovative people, for creative people, there's all sorts of ways to infiltrate.
Like what? Like how would a graduate get their foot in the door at Bank of America?
If I were a health coach who graduated from IIN, what I would do is I would find out who was the head of HR, who was responsible for wellness in that organization. I would look at what programs they had. I would analyze the program they had. I would look at the deficits that they had and whether it's successful or not. And then I would come up with a solution, and I would go to them and say, look, here's what you're doing. Here's what's working. Here's what's not working. Here's why. Here's why I think we can do it better. And here's what the program is. And let me help you design it and create it.
That's fantastic.
But that's what I would do.
Learn and to execute on your unique vision. Define success for yourself. Figure out what that means to you. Don't get taken over by the world's definition of success.